Yeah, we can do that. Yeah.
Okay, everybody, we're going to do a timeout with Susan Calvin here for left heart cath, Dr. Carroll, and no allergies. Information's on the whiteboard.
Yeah. Okay. Okay, Susan, we're going to get started. So the first thing is a little bit of numbing medicine, okay? A little lidocaine, stick and a burn. She had been having some symptoms of shortness of breath and some chest pain, and her primary care physician had gotten a stress test, which was mildly abnormal. And so we decided that this would be the next best thing to try to figure out if these symptoms, which were not necessarily related to heart disease, but could have been, whether there were serious blockages that need to be fixed or not. Okay, now we're going to put our small sheath in place. That's how we do the procedure. It's like a small straw. You might feel a little bit of pressure in your wrist. So this is called a coronary angiography, which means, basically injecting dye into the heart arteries and looking for blockages. Then next I'm going to inject a little bit of medication. That's to keep the artery from clamping down. This may burn a little bit, okay? That's normal. So this is the catheter that we'll use to inject contrast into the arteries and look for blockages. We're just using a small wire to get that up and up to the heart. Thank you. Good. Okay, go ahead. Go ahead and give the heparin. Go ahead and flush. Stop. That's awesome. Everything we do carries some slight risks, but bad things are very uncommon in this procedure. We do a lot of them and take care of people and make them feel a lot better through this. And so, it's always one of those things where we're weighing the risk and benefit, and if we've decided to do it, we think the benefit outweighs the risk, and we're really trying to help you. So right now we're just we're taking pictures to look at the heart arteries. We're going to give a little bit of medication just to make sure that sometimes the artery can spasm when we put our catheters in, so we want to make sure that that's not the case. We just take pictures at different angles to get different views of the arteries. That was the artery to the right side of the heart, and then we're gonna try to get in to the left. Susan, can you take another big breath in for me? Hold it. Breathe when you need to. Fantastic. Yeah, we can exchange. Okay. Can I get a JL 3.5 catheter? So sometimes the catheter shapes, some work better than others. And so I'm going to try a slightly different one, see if it's a little bit easier to get in there.
3.5.
JL 3.5?
Yes, please. Thank you. Okay. She was a relatively healthy person who, was an outpatient. I thought that, it was likely that we'd be successful at being able to accomplish the procedure through the arm. And, the benefit really is that, for one, the biggest benefit is that it's a lower bleeding risk than going through the leg. So, obviously we want to try to prevent any complications of the procedure. So that's number one. Sometimes people feel like it's a little slightly more comfortable because they don't have to lay flat for several hours after the procedure, whereas if we go through the leg, they have to. Sometimes, there's a slight chance that we're unable to complete the procedure through the arm, either because the arteries are very curvy up in the chest, or because of the way the heart sits in the chest, or if they're very complicated blockages that we need to fix and use very larger catheters, those tubes that we use to do our procedure. Susan, take a big breath in for me. Breathe normally. Ready? Can you monitor sound just a little bit, please? Thank you. We take pictures at multiple angles to make sure that sometimes blockages can be somewhat eccentric, or meaning like on one side of a vessel, and we see them better in certain views than others. So we just kind of move our X-ray machine around and take pictures at different angles and look for blockages. You go to 10 amps, please. Susan, yeah, we have good news for you. We're all done, okay? I'll show you the pictures in just a second. You have some minor blockages, but nothing that we need to put balloons and stents in. So these are things we'll treat with medications and get you feeling better. Okay? All right, any questions I can answer for you right now? Okay, we're gonna get this small tube out of your wrist, with a little bit of bracelet that holds pressure on it, and then we'll get you home, midday. Okay? Sound good? Yeah, that would be fine. As long as you're not doing heavy lifting with that arm, that'll be fine. So if you want to look this way, I'll show you the picture. So this is the artery to the right of the heart. Our catheter is kind of in there, and it's at a little blockage, and so I gave some medication, and it's kind of a mild to moderate blockage there. That's not something that we would need to fix right now, okay? We're going to treat you with good medicines for the heart and keep that from getting worse, okay? This is a little bit different view, but the same artery, okay?
So you can keep getting worse.
Well, that's our goal with the medications, like for cholesterol and things like that. Our goal is to try to prevent the blockages from getting worse, okay? So this is the artery to the left, kind of the front and the side of the heart. And again, there's some kind of minor irregularities there. Maybe like way down the vessel, there's a little bit of a blockage there. But these are things that we treat with medication. These are not things we treat with balloons and stents. So that's good news.
Yeah.
It's a little bit different view of it. Okay. Any questions for me?
Nope, that looks great.
Okay. Obviously, if things change, we're happy to bring you back, but there's nothing that we need to do right now, okay?
All right.
This is good news. So we're going to get this tube out, and then we'll be all done. Get you off this hard bed, okay?
Thank you.
All right, you're welcome.